The reason you have the definition of contacts is because of the way the virus spreads. And it's a respiratory pathogen, and so the virus can be released from your mouth and your nose when you talk or cough or sing, but it can also be passed if people have direct contact with one another. What we learn about through these studies is to really get much more detail around what that contact entails. What we know is most transmission is happening among people who tend to spend a lot of time together. It is important, the time element, the type of contact, if you're hugging someone, if you're kissing someone, if you're caring for someone, especially if they're sick, those are all really important to define contacts.
The US is accounting for a third of all world cases at the moment over the last number of weeks. The epidemic in the US is punishing. It's widespread. It's quite frankly shocking, to see 1 to 2 persons a minute die in the US, a country with a wonderful, strong health system, amazing technological capacities. So I believe that the CDC are doing their job. They're trying to identify each and every possible significant contact. They're really reaching out to try and get people to stay the course and to use the hope of vaccines, but just to remember there are a number of months to go in which everyone is going to have to, unfortunately, avoid those hugs. And maybe because we're here talking today about hugs and about how much we would like those hugs over the holiday period and just how getting that close to people in a situation with intense community transmission can be so tragically dangerous. And that's, I think, the awful, brutal dilemma that we all face. It's a horrible thing to think that we would be here as the World Health Organization saying to people, don't hug each other. It's terrible. But that is the brutal reality in places like the United States right now.